Hi, my name is Ellie Forbes. I'm a third year Bachelor of Nursing student at Swinburne University, and I will be applying for the open 2024 graduate nursing position. In this video, I will cover why I would like to become a nurse, career aspirations I have as a nurse, a challenge I have experienced on placement, unique strengths I bring to the role, and the biggest challenges I foresee happening in the first year of being a registered nurse. I want to be a nurse because it's an area of work which has always fascinated me. The clinical aspects most, but also the people side of the job. All through high school and my life before joining the nursing program, I was always very intrigued by the real life medical shows or stories, and I always had a desire to learn and know more. I think it all really started when I learned more about what I went through personally after a burns accident when I was a child and the lengths the doctors and the nurses had to go through to help me. A fascination and awe of the intricacy and the genuine care that I received, and the praise that I heard from my parents about the nurses that were such a big part of my recovery. As with any new career, it can be quite daunting and you worry about if it's the right path to take. However, for me, once I completed my first placement, I was sure that nursing was the correct path for me. Being able to help those who were unable to help themselves with daily tasks or the clinical sides of medication rounds and wound care, there was never a moment where there wasn't a chance to constantly learn things, and that was something that I really loved about it. It all felt right. A career aspiration for me is to gain certifications in both IV cannulation and critical care. IV cannulation because it's something that I have seen done on placements and is a fascinating clinical skill in which I would like to be proficient in. By being cannulation certified, I will be better able to assist both my patient and my working team in being able to provide an added level of care. It's a new challenge for me, which is something I would like to master and therefore further my skills and abilities. The critical care nursing certificate because it's an area of work which is incredibly intriguing for me and will assist me in other aspirations of mine, which is to experience working in emergency department. I believe the course is going to be a challenge. It will be something completely new, which for me is quite exciting. I like a challenge, something that will push me to do better and be better. Overall, it will assist me in providing better care for patients that is both safe and scope appropriate. I will be upskilled, which is a positive thing to have also. A second career aspiration for me is to experience specific wards such as emergency and theatre. Emergency because it's an area of work of which intrigues me, but secondly is a place where I believe can teach me a plethora of skills and confidence building, which will assist me in my career moving forward. It's a high pressure environment where cases will vastly differ, as it's usually the first point of contact for all patients in the hospital before moving to specific wards. Furthering my critical thinking skills, my clinical skills, and communication skills as well, both with co workers and patients, as all are a part of the health team for patient recovery and treatment. The theatre wards, because similarly to emergency, it's a new environment for me in which I can further learn and expand my abilities. Working within different hospital wards will only allow me to further my knowledge, skills, and confidence, which in turn will give me a greater ability to treat my patients safely and appropriately with care to the best of my ability while remaining within my scope of practice. A challenge that I encountered on my placement was trying to insert the needle for a blood draw on a heavily tattooed patient, my first ever non-simulation patient. In the simulations, the dummy arms, they're free of tattoos, the veins are quite large and they stick out, making it easy to use markers and to see where you're sticking. However, in this case, I really had to rely on my previous knowledge, my touch sense, and prior knowledge with markers as well. For me, I was excited and slightly nervous, but before going in to do the procedure, I watched an educational video on how to approach this situation and for any tips on how to find and lock the vein so that the stick would be like any other. I asked my buddy nurse and another nurse who was nearby, of whom both had tattoos in the same spots, and it allowed me to practice feeling for the vein and how I would anchor my hand to stick the needle, minus the needle, of course, and become more confident. Upon entering the room, I felt prepared, calm, and confident. I did just as I practiced. I found my mark. I was able to get the blood draw on the first try as well. The real takeaway for me was educating myself on situations that I may not be so sure on, and better to understand for both the safety of myself and the patient, but also speaking up and asking fellow nurses for assistance when needed. A unique strength I believe I have is my resilience. My ability to withstand tough situations and interactions with others and being able to recover quickly. In previous job roles, both within the retail and hospitality areas, there have been many customers who have not always been pleasant and instead quite rude and combative. Learning on how to deal and handle as well as de-escalate situations like this have been extremely helpful throughout all aspects of my life. However, I feel like this strength will assist me when dealing with similar patients in the hospital setting as a nurse. Alongside people interactions, dealing with situations that may be confronting, nerve-wracking, or emotional, I feel that being able to withstand and regain confidence quickly is a key strength in being a graduate nurse as well as a registered nurse in general. The job is not always an easy one, and being able to deal with the good and the bad as it comes and continue the job in a safe and appropriate manner is key. I believe that a second strength I possess is my ability to adapt in many situations. I have been in many different work environments in the past where critical thinking and working under pressure were key to success. Prior to this, I was working within the finance and economics world, a profession where the markets are constantly changing, and to be able to keep up with it, I had to constantly be able to critically assess a situation in a timely manner, adjust my view and strategy to face the obstacle, rely on my team, and maintain confidence in my knowledge and skills. Within the nursing world, while we all would like a clean and simple patient case as well as shift, this is not always going to be the case. Some patients may be complex or could take a turn for the worst with their health quite quickly, and I will be able to assess the situation, adapt to the environment and the information as well as the presentation of the patients, and continue with the best course of action that is both appropriate and within my scope of practice as a graduate nurse. A challenge I foresee in my first year as a graduate nurse is communication with a team that's both new and different. There are all types of members that will be on this team, from other graduate nurses, registered nurses, doctors, and other allied health specialists. Being confident enough to engage and communicate effectively and efficiently to understand the correct information and the course of action. The key strength to overcome this, I believe, is just to be confident. Ask the questions, as there are no silly questions. Err on the side of caution and confirm when unsure rather than to act. Learn how to interact with different team members and adapt to the situations and personnel at hand. A second challenge I can foresee is the use of electronic records to paper records. The placements and university studies I have completed have all been paper, so entering into a new environment which is electronic can be a little intimidating. However, asking for assistance when unsure, receiving or asking for training on how to use the systems, and communicating with the team around me on how to accurately navigate around this is a perfect way to combat this challenge. The third challenge will be that working as a graduate nurse full-time will be a completely different environment and pace of life than in the previous years studying. Being able to adapt to the new challenges, the new schedule, people to work alongside with, as well as actually working as a graduate registered nurse. It's both intimidating yet thrilling. To overcome this challenge, I believe that having a routine schedule that works with the shifts given, healthy eating, getting adequate sleep, enjoying the days off to recharge from the trials of work, and constantly learning and expanding my knowledge and confidence in the position will all support me in performing at my best. Thank you for your time for listening to this video. I appreciate it. I look forward to the next steps in the process in the job application, and I wish you a good day. Thank you very much.